Hello viewers, I am Dr. Shaileshkumar Garge. Today we will see about the breast cysts. So cysts are nothing but water-filled bubbles or water-filled cysts. So this cyst can be simple when there is like very thin rim and a clear fluid in that, and it can be complex when there is anything abnormality is found, like whether the cyst wall, rather than being thin and uniform, it has some bulges, or there is solid mass in that, or there is a thick fluid within it, which can be suspecting for the infection or a complex cyst suggesting of a malignancy. So very important, this simple cysts, they can be single or they can be multiple cysts. So the number of cysts can be present, or this cyst can be present in one breast or in the both breasts. And these simple cysts are one of the common problems in the breast, and they are seen in third and fourth decade, usually menstruating women during the time of lactations. So these cysts are usually very common in the women, and it is very important that you regularly examine the breast to see this cyst or lumps are increasing in number or in their size. So if you find this cyst, first thing, most of the times, because they are simple cyst, that means they form on its own and they disappear, so you need not to worry. But if the cyst is persisting since long and it is not disappearing, or it is increasing in size, or they are increasing in number, it is always better to consult your doctor near you. So they do the physical triple assessment, that is your doctor will examine your breast for this cyst or the swelling, and if required they'll advise you for the imaging, mammography or sonomammography. And if there is anything, depending upon the BI-RADS grading, which you can watch my video for the BI-RADS grading, depending upon the BI-RADS grading, they may ask you to go for the aspiration for cytology or FNEC test of this cyst. So once this assessment is done, and once the report comes, whether this needle test or FNE test, either for an infection especially in a complex cyst or a malignant cells, most of the time simple cysts, they don't require even the FNEC if their BI-RADS grading is either grade 2 or early grade 3. So if this BI-RADS grading is there, your doctor may not even suggest for the FNEC test. Sometimes if there is large cyst, they can do the aspiration to decompress the cyst and can send this fluid for cytology. But if the cysts are reforming or increasing in size, or they are forming repeatedly, then you can go for a surgery. This is the old method of treatment for this breast cyst, which is recurrent or large cyst. Or you can wait and observe. Most of the times they disappear on their own. But if the cysts are forming repeatedly, even after aspiration or even after surgery, or they are multiple in size, then you can have this non-surgical treatment, that is microwave ablation or thermal ablation for this cyst. So where a simple needle, same like the needle aspiration or FNEC test is done, is placed into the cyst, and where we ablate the wall of the cyst, so that because this fluid is formed by the cyst wall, so once you ablate the cyst wall, the fluid formation will stop and the cyst will collapse or shrink completely. So this is non-surgical treatment method which is available at Citi Vascular Hospital. So rather than waiting for the cyst to increase in size or increase in number, or rather than going for a invasive surgery or major surgery for the breast, where there will be cosmetic defect and major scar or infection, possibly risk of the surgery, you have an option of treating with them with non-surgical method, that is a microwave thermal ablation or RF ablation. If you have any doubts or comments regarding the breast cyst treatment or breast cyst, you can write them in your comment box. We'll be happy to answer them in our next video. Thank you.